Hello, my name is John Adams and I'm a solution engineer at Nutrient. And today I'm going to demo a problem that I recently experienced during a visit to my local doctor's office. So this is a personal one for me. Just a little bit of background. I go to what is seemingly a modern doctor's office. Yet when I check in, they hand me a clipboard of 12 to 15 pieces of paper, old school, old-fashioned paper. Nothing is pre-filled, even though they have all of my information from the many times I've been there before. I have to fill out this clipboard full of paper with a pen, and many of it is redundant requests. I know the information they've had for years, and it's just very frustrating. And so today I wrote an application um, that I think would alleviate this. And credit to some, I know there are some medical facilities, offices who've gone through a digital transformation, and kudos to them. I think that's incredible. But for any remaining facilities or any patient kind of intake thing, doesn't have to be medical. I think this would just be a much nicer user experience. It would save so much paper, save so much user input and even transcription from the paper to the data, errors, fraught with errors, spelling, even hard to understand or read some people's cursive, things like that. I really don't know how this is 2025 and we're still entering information on paper when we go to things like this. So, some technical background about what I'm going to show you. It is a React application written in Next.js, and it uses the Nutrient Web SDK. Obviously, in the real world, this would be connected to a database with real patient data, with the ability to read and write and save, have state so that anything you filled in or changed could be updated to the real system. Mine is just some JSON data that is, in the application, and it's all completely made up. So any similarities to anyone out there, apologies. This is just some random data that I created. Um, I'm going to show you what I think the portal could look like. I imagine it being something you'd show on a tablet or a device. When you get to the facility, they could hand it to you pre-filled with your data. Maybe you only have to change the things that's new, or on the spot, things like, this is the area that I am here for today, or, this is the concern that I have. And you sign it with electronic signatures, and it would just be updated to their system. And then, patient could take literally a minute or two to check in rather than filling out pages and pages of paper. So I'm going ahead and share my screen. And so this would be a mock-up of what you would see on the device. And it's just a, hello world screen, but allow the patient to see that they're there for, their appointment, and it's their information instead of somebody else's. And so go ahead and click begin check-in. We have several forms to fill out today, the patient demographics all the way down to the financial authorization, financial responsibility, HIPAA authorization, etc. So just grab the first one. You can see it's already pre-filled with the patient data and nothing much on this one. Just double check really that everything's there. Go ahead and sign it. I will type Sarah Johnson, and I'll change her signature style. This is one of the things you can do with the SDK. You can allow the user to draw, you can upload an image, or you can type to fill out an electronic signature. So I'll go ahead and select that. Everything looks good. Go ahead and hit complete, and I'll go ahead and move on to the next one. This, again, is information that my facility should already have about me, so this should just be a review. If something's different, obviously, you could change it. Looks good. I'll go ahead and sign it. I'll just go ahead and type. Move on to the next one. And already I'm having flashbacks of filling out the clipboard full of paper and making me angry that I had to do that so many times. Again, if everything looks good, just breeze through it. If something needs change, your insurance information should be easy enough to change in the form fields. Medical history, all looks fine. Scroll down again. The signature. One thing that we could do using the Web SDK is instead of having the user have to sign each form, we have the ability to save signatures locally. So for each patient, you could click into it, and rather than have to type it each time, it would be pre-filled out. And then upon the completion of the packet, it would clear the signature from the device so that it's not stored, so their signature isn't on the device once they're done. That would be a nice UI improvement. I didn't do it on this one, but it's something that you could do, is save that storage, save the signature to local storage so that the user doesn't have to keep signing every time. So go ahead and complete. Move on to the final form. And there are some things that you would need to fill out on the spot, like your authorization for today, your cancellation policy, etc., how you're going to pay. Again, fill in the last signature. And I believe that should complete the intake form for today. This literally took seconds per page rather than the minutes it would take me to fill in with a pen and paper. So I think that's much more of an improvement. As far as what we could do to improve it besides the signature storage, we could do things like integration with other systems. So, outside of the one system, hook it up to others. You could even insurance information, integrate with an insurance provider. The things like that, I think, are ripe for adding, enhancements to this. I'm not in the medical field, so I don't know as much about that. But as far as the forms and integrating that into a system, I know this could be a big improvement from the paper and pen process that I currently go through now. So just to kind of wrap up, I think the patient experience of this would be much nicer. This literally took me just an afternoon to implement using our Web SDK, and I'm happy to share the code for anybody who wants it. Like I said, this is a Next application, so anybody who writes React or Next should be able to get through this pretty quickly. I think as far as what you'd get out of it, obviously the digital transformation, a lot easier to do than pen and paper, reduced manual entry, reduced error for transcribing the information from paper to the system. You get a streamlined workflow, and then for the user, I think this is just so much better than being handed a stack of papers. You could integrate it with an EHR, electronic health records for anything like that. We could enhance this with multi-language support. Things like that I think are just ripe for improvement, but I just wanted to do this quick demo to show you just one of the things I think are possible with improving user experience using our SDKs. I hope you found this demo helpful. As always, feel free to reach out to us. I'm happy to talk code or SDK, give any advice on your project. Feel free to reach out to us. Again, my name is John Adams at Nutrient, and I'll see you on the next one.